Myself, Dr. Amit Kumar Banerjee, preventive cardiodiabetologist, one of the topmost physicians on its merit on the subjects of primary preventions. Now, you must know what is primary preventions. There are three stages of disease prevention. One is primary prevention, that means that before the disease has started. Secondary prevention, when we actually give medicine or advise something. That's why when the patients come to a chamber with increased blood pressure or hypertension or increased uric acid and increased something. And tertiary prevention means the stage of disability. Suppose after the CVA, the patient's presents with paralysis and the patient has to be rehabilitated for walking or doing some activities. This is the way of tertiary prevention. So the main motto of the disease is primary prevention. I am just today concentrating on the subject of diabetes mellitus, and gradually in the YouTube, if you see my the video, you'll gradually know everything about the primary prevention. Now diabetes, what is diabetes? I will tell in short and gradually will learn. It means increased blood sugar in your body. Now this diabetes is increasing like a rapid pace in us, and by 2045, India will be the global capital. What is diabetes? Diabetes is increased blood glucose level in your body. So when the fasting blood glucose becomes more than 126, the postprandial blood glucose or the blood glucose after 1 hour 45 minutes after you complete your lunch, or it is more than 200, and the glycosylated hemoglobin, the surrogate marker, very important thing. I will go into detail in each. Everyone covers a lot of time, so and it becomes more than 7, we call it a diabetes. But our desired range is the blood sugar fasting should be less than 100 and the postprandial should be less than 140. So there is a huge population who are in the range of fasting 100 to 126. You see, you ask anybody and he will say my sugar is controlled, I have only 117 fasting sugar. And he says at this age it is very normal, I have 160 pp blood sugar. So during this age, and he goes on doing bad lifestyle and not controlled over the diet or any physical activity or not consulting the doctor. Now the huge range, that is between the fasting between 100 to 126 and the postprandial between 140 to 200, we call it pre-diabetes. Previously it was used to be called as latent diabetes. Now it is pre-diabetes, means they have high propensity to become diabetic in near future. Now the main motto of the International Diabetic Federation is to catch them young. That is the concept of primary prevention. Because the earlier you detect diabetes and you initiate treatment, lesser is the complications. This much is today's discussions, and I will gradually go into the subjects through my subsequent videos. Thank you. Good night, everybody.